Hi, everyone, and welcome to the special simulcast, the Neil Haley Show and the Ultimate Men's Movement with our host, Dr. Jack Rocco. Dr. Jack, we're going to talk today about something that we had a topic that's gone viral on this show, and that's with Dr. Loria. And he really gave us some understanding about a topic matter that, a lot of men don't talk about. And explain that a little bit more, Dr. Jack, because we always talk about something else in size than this topic.
Yeah, and we've had a little boost in our business as far as this goes. That there are pockets of guys who are aware of this and who understand it. And there's various ways to do it, and it's male enhancement. And the idea is, we use a lot of the techniques, and some guys are using similar products to what women or men do with tissue bulking. Like with lip enhancement, filling in wrinkles, by injecting what's called Juvederm, or it's a hyaluronic acid is the generic name. It's a way to add additional filler into your face, most commonly, the lips most commonly. But you can also do it with the male member. And it's actually perfect for that role because there's a lot of additional skin that's already there. It's kind of a moving target. It's cold, it's hot, it's the size does change, and your skin accommodates that like an accordion. But we can capitalize off that phenomenon or that anatomy by filling that skin with various things. Some people use fat, some people use the hyaluronic acid fillers, and we're using a product that stimulates collagen production, which is, your body makes collagen for a lot of, for healing and for a lot of different purposes. But it's a way to capitalize on that skin. And by injecting that skin and filling that skin, it adds girth or circumference to the penis. And I was thinking, a good way to explain that, maybe I'm a nerdy doctor, nerdy physics, former physics student. When you talk about gauge, when you talk about a gauge, like the diameter of something, and by increasing the gauge slightly, you increase the volume much more significantly. So a 25 gauge needle versus an 18 gauge needle, gauge is opposite. So the smaller size is actually the bigger thickness. Or with a straw, if you try sucking, a drink up with a little cocktail straw versus a big straw for milkshake or something at McDonald's, you're getting a lot more volume and that's coming through that diameter. So same thing with male enhancement. By filling that skin, you're able to increase size and therefore increase volume, which is really helpful for sexual stimulation for the woman. And they always the common I guess lexicon about size, how long, 6 inches, 6-pack, 6 figures, but most of the stimulation occurs in the inner few inches around the clitoris. So by increasing girth and increasing size, you get an exponential increase in stimulation for the female. And like I said, we've gotten a number of calls lately. We've done a number of procedures lately. It seems to be catching on. And the way we do it is, it's a great way to do it. Dr. Loria, he has patents and the intellectual property on a substance that it's a silicone emulsion. You use different products in mixture, and as you mix them together, it forms like a little slurry. And that slurry has, very tiny microscopic particles of silicone in it, and it just goes into the skin. We're not going into the working elements. So it's in the skin. So it fills that skin with this filler. And by doing that, your immune system will send white cells and the various healing cells into that region. And what it does microscopically is it engulfs those tiny particles of silicone and walls them off. Um, and then it walls them off with, it forms collagen over to wall them off. So that the great thing about this procedure is that it's permanent. It lasts forever. With the Juvederm, women will say, they've got to go back every 6 months or so to fill in various spots, because it eventually gets absorbed and removed by the body. Whereas this is adding the collagen, and once the collagen is in place, it's permanent. So, it's perhaps slightly more expensive to do our procedure initially, but it lasts a lifetime. And you can add on top of it. We do 1, 2, or 3 procedures. You can do them in sequence every 6 weeks. And by doing it in sequence, one, you spread the skin, so the skin will stretch. And then the next time you can spread the skin a little more, and then spread the skin a little more. So you can, it's additive onto your results. So it's really something that's been interesting to work with and to see in practice.
And it's interesting, Dr. Jack, when you talk about this, who do you think are the best candidates for this?
Well, I think really any sexually active male who has an interest, I mean, I think, there's different pockets, straight men, gay men, anyone who's interested in a little more size. We've had, some of our, just to anonymously talk about some of our patients, we had some interesting patients come in. One's a guy who, younger guy, he's actually in the process of getting married. And so he's come in, and at first he was very shy, because he was kind of small in size, and he kept asking us about, will it help with length? And typically we're not, we don't push it or promote it as something that can increase length, especially erect length. And like I said, it's a moving target. Size flaccid, size erect can change, but usually your erect size is your maximum size. So like I said, he was very small, and so we did our first procedure, and he was tickled pink. First of all, he kept telling us, no pain, no pain. He had zero pain, before, during, or after the procedure. He went through the period. There's a 4-week period of bandaging, in order to keep it straight, because as the collagen is forming, if it's in your underwear, your pants, and it's bent in a way, you could get a crease in it. You could get a little asymmetry to the healing. But he said he went through it quickly, and even before he was fully done with his healing, before his 6 weeks, he was very pleased with it, and he starts talking about doing a second procedure. And he said, he goes, it really did help with my length. So like I said, that flaccid length, it added some permanent size to him. And that was, he's very pleased with it, and he's actually scheduled for a third procedure. And, both procedures have given him some quote unquote length. But like I said, it's that filling that's maintaining that skin in more of an erect posture, so that even when flaccid, it does have a longer appearance to it. So he was pleased. We had another patient that was also very interesting to me, because he came in with, he had a few procedures done in Tijuana, Mexico, of all places. And when they did it, they did the temporary procedure. So he had the temporary procedure. And his shaft was fairly girthy, but they didn't do the glands, the head portion. So by not doing the head portion, he was getting the size of the shaft. And I say it kind of looked like a turtle with its head pulled in.
Oh my gosh.
An unusual analogy, but I think it gives you the picture. Like the shaft was enlarging, but his glands wasn't enlarging, in proportion. So the first thing I offered him, I said, well, how about if we let's start with the head and see if we can get them to match up a little bit. And, the before and after pictures, I wish I could show them, because it was impressive. The before and after, how it exactly did what I was hoping it would do. That it expanded the head, it brought the head into more proportion. And now that that it's in more proportion, he wants to go through another procedure of both the head and the shaft, in order to, to get and maintain some of that, that volume and that symmetry to the, and I enjoy that, I mean, as far as, people say, well, you're trained in orthopedics, and, how does orthopedics and men's health go together? One, I'm licensed and able to do a number of things, as a physician. So testosterone, some of these replacement therapies, and they're not, out of my depth of focus and expertise. But also I did 2 years of liposuction, which is, more of a sculpting and tummy tucks, but also ortho in general. In orthopedics, we do a lot of plastic surgery type procedures, when we're doing, especially, I mean, in residency, and if you're working with hand surgeons, skin grafts and, flap transfers, taking soft tissue and covering bone. If you have a really complex, like a tibial fracture where you have skin loss as well as bone fracture, you may have to take muscle or tendon or skin, full thickness graft, partial thickness graft. So my whole career has had a good deal of plastic surgery and cosmetic surgery that kind of comes in the package of orthopedics. So I think it's been a very rewarding transition, a very nice way to kind of exercise some of my artistic skills, and it fits right along, and it's nice to see when it all comes together.
Absolutely. And the everyone's so happy with the surgery, right? That's the thing you're
Yeah,
seeing.
yeah. Like I said, I think the biggest fear that most people have is the pain. The idea of injections and needles into that area does not sound desirable for anyone. But like I said, what we do is we use a very concentrated lidocaine cream that we put on, and usually I'll put the cream on liberally, and then wrap it with like Saran wrap type plastic wrap. So it allows it to really soak in. We'll let it sit for a half hour, 40 minutes, and then I'll come back and I'll test it with a needle. And most of the time, they don't have any sensation of it, maybe at the borders. So then I'll inject, a little lidocaine into the base, do a circumferential numbing of the area, and they don't feel the needle. I've not had a guy really complain about the needle, but we're careful to, or if we need to spend more time, we're not in a hurry with this. We take our time, and once it's numb, then you worry about, oh, it's going to hurt afterwards, but our patients really haven't had any significant discomfort. By the time you place it in kind of a little splint of sorts, it's a soft tissue bandage wrap that keeps it, I said, you want to keep it straight and uniform. You don't want it bending so that the fluid can maintain. We put a rubber band at the base so that it doesn't flow into the pelvic region, the pubic region. So it keeps the filler there. You keep it straight. Then they do changes every couple days or so, and none of our patients have really had a problem with the dressing, and they're very pleased with the results. And it's nice to see these guys wanting to come back, for a second and even a third procedure. And it's not as uncommon as you think. So it's really something that I think it adds to a lot of male confidence. It doesn't affect function since it's in the skin. And like I said, and we're very careful to not, it's easy to do once you're comfortable with it. It's easy to do to keep it in the skin, not a difficult thing to do. So like I said, it doesn't affect function, but just gives you that little extra girth that's very important. Like I said, for stimulation, for confidence, and appearance.
And that's an important thing for some men, as you said, you talked about ones that are smaller in size, where you
Yeah.
found that.
And like I said, even, we had a patient come in and he was not small at all. He was well endowed, but just was active and, liked the idea of being a little thicker. And he was very educated. A lot of these guys, there's pockets of guys out there that are aware of this procedure, that seek out this procedure. And especially, being affiliated with Dr. Loria and Loria Medical, I said he's been doing this for 12 years, I think, at this point, has done 11, 12,000 of these procedures. Very few complications. If there's any complications, they tend to be minor and just involve the skin. You could get a skin wound or skin breakdown like anything else. We use a good deal of antibiotics, and we use some steroids to limit the inflammatory reaction so that it's not you don't get skin ulcers. So, there is some post-op care, but it's not been something that, our patients have had a problem with. They're pleased with the results. And who am I to judge on these things, Neil? And, married couples come in, singles. There really isn't a specific demographic. And I
No.
said, I've seen that range of demographics, and all ethnic groups, all income ranges, and it's like I said, if you ever fall down that rabbit hole on the internet, it's not
Yeah.
that uncommon. There's a guy in Vegas who posts very liberally about his procedure. But once again, he's doing a hyaluronic injection. A lot of people will do the hyaluronic injection. And I think the thing that I really like about Loria's procedure, I like about the silicone emulsion procedure, is that it's a permanent, you don't have to keep coming back every year. And like I said, it's expensive to an extent either way. But if you have to keep putting out $7,000, $8,000 a
Right.
year for a temporary procedure, ours is very cost effective when you consider that it's lifelong.
Do you guys offer financing?
Oh, we do. Yeah. Yeah, and we can work out deals, and we've done that with our patients. If you put a reasonable down payment, and we can either finance it locally through our own company, just sign a promissory note, or we work with Care Credit. We work some
Yeah,
other.
that's what I was saying. Is so that
Yeah,
you guys
Care
have care
Credit.
credit.
There's some others. I had a guy yesterday who called. We booked him for his procedure already, and he's going to be doing it in about a month. He signed up for, and he's been approved for a certain amount through Care Credit. But we're also going to, in the meantime, he's hoping to put some down on his credit card to pay what cash he has available. So within a month, he may have it paid off. He may or may not use the Care Credit. But either way, we work with financing, and we can work with the patient. Like I said, if there's a reasonable, if we do a little credit score check, and reasonable down payment and a reasonable payment plan, we can work with you on that.
And I think it's so important for guys that want this. And I bet you every guy would put and go in line mates say they want this, even if their woman didn't say that. So that's the other part of it, as we all know as guys. So, and I think once this goes viral, Dr. Jack, more and more, because you see we did that one video, you'll be like, Neil, I want to do 100 of these videos with you. And we
Yeah.
were playing around today with fishes. So we'll have to think what people
Oh
think of
yeah,
fishes.
yeah. We got a little post coming out that I thought was kind of cute. You helped us with that quite a bit. I was out. I'm in North Carolina right now, and we were talking, and I'm like, I'm going to do a little post. So I went out there and I fished, and I'm talking about it's not the length of the fish you catch, it's the girth of the fish. That you want to fish with some meat on the bone. So I think that's true for exactly what we're talking about. Like I said, a little bit of added volume gives you a good deal of functional volume that you're able to use, because otherwise the skin doesn't expand. The skin expands to accommodate the erectile components, but the skin itself doesn't expand. And
So
what we're
here's a
talking,
question for you. Is there a way to increase girth or size without doing anything, with doing exercises? Is that true or false?
well,
Because
not exercise per se. It's like I said, we're talking two different things. Like I said, the
yeah.
skin, we're capitalizing off increasing the actual girth of the skin, which will be additive to the girth of the erectile components. So it does give you an increased girth. I've seen the patients, and the patients say, yeah, I do have a little more length too. But like I said, the length is it's always a moving target.
No, but is there a way of doing it with just extra? So just asking you.
I don't, we also do procedures with blood flow, which helps with an erection, which helps with the erectile components. If we can improve blood flow, if you can improve your bloods, get your LDLs down, have a little more blood flow, it's healthy for that.
Losing a little weight too increases.
Yeah, I said, and some of the products that enhance size that claim for this, they don't really work on a long-term basis. They work as long as if the product will relax the vessels, it will increase blood flow. But there's nothing really that increases size per se, other than it just relaxes. By relaxing the blood flow, the blood vessels, you get more blood flow, which adds size. But as far as permanently enhancing size, there's no product that permanently enhances size. We'd all be on it, But like I said, if you take something, that increases.
But haven't you seen those machines that they say that they can increase size?
What's that?
Did you ever see those machines that are out there? They say that they can
they
increase
got
size. Or pumps work. You can see these are.
Pumps can do it, right? Pumps can do it, but that's a prolonged practice. Some guys are doing pumps that can increase some of that. But once again, it's bringing excess blood flow to the area. It's increasing the erectile component, but it's not, what we're doing is capitalizing off the skin, making the actual skin thicker. And I said with a little extra thickness to the skin around it, you're adding a circumferential volume to the whole element. So it is, like I said, it's the fillers is definitely a biohack or a way that you can do that without medications, without constantly being on something. I said the pills, it helps with blood flow, but it doesn't help with actual size. Okay. And like I said, the way to capitalize off that extra skin and expand that skin, like I said, when you do it in series, if you do a couple in a row, each time your skin will expand and stretch a little bit. I said in orthopedics and plastic surgery, they do that a lot. If they're doing a breast implant, they don't necessarily have the skin to fully cover it, so they'll slowly increase the volume with saline in order to stretch the skin. You got to give the skin time, and various techniques and ways that plastic surgeons gain extra skin. When I was in the service, a lot of guys were having their tattoos removed. And so if they've got a big tattoo that was exposed, they had to cover it up or get it removed. But you couldn't take out all the skin at once. You had to take it out and then stretch it and close it, and then go back in again, and then same thing, stretch it and close it. So it takes time for that skin to expand. But what we're doing is we're expanding the skin by increasing volume, and then going back a second time and increasing it a little more. So I said it's a safe procedure. It's an effective procedure. I think the permanent way is much more economical, and it's permanent. It's something that if anyone has an inclination or desire, I think it's worth looking into. Do your research, and look at your options. But I said the downside of using the Hyaluronic temporary filler is that you need to do it over and over again, which becomes prohibitively expensive.
Okay. All right. Go to theultimatemensclinic.com, and that's in New Bedford, Massachusetts, and schedule a call with Dr. Jack today. You're ready to work with them.
Thank you, Neil.
All right. Appreciate it. That was
hope it's helpful.
All right. That was a special simulcast, the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.